Good morning! Good morning sa lahat. So bago pa mabisi yung kapaligiran ko, magbabasa na ako kasi ngayon, Friday ngayon, ngayon dito sa sa health center, prenatal day. So maraming buntis. So magiging busy yung araw ko pag dating ng 8 o'clock. So bago pa dumating yung 8 o'clock, magbabasa na ako. Fibroids. These are benign growths in the muscle layer of the uterus. Although the label fibroids is often used as a general term, they are actually part of a group of benign tumors called leiomyomas. Leiomyomas. Leo, Leiomyomas. Myomas. Lemi, N-E-I-O. Leomas. N-E-I-O-M-Y. Growths consisting of more fibrae or connective tissue, ligaments, or collagen fibers that muscles are fibroids. Growths with equal fibrae and muscle content are called fibrom, fibromyomas. Fibro, fibromumas. Fibromumas. In muscle-only growth are called myomas. Ah. Growth with equal fibrae and muscle content are fibromyomas, and muscle-only growth are called myomas. Myomas. About 25% of all women of reproductive age have leiomyomas in one form or another. They are more common in women of Africa or Afro-Caribbean origin, but many are unaware of them. They usually appear in cluster of spherical nodules, clearly demarcated from the surrounding uterine muscle tissue. Mostly they are small in size, but have been known to reach vast proportions. In a remote area of India, I once arranged the surgery of a woman who had a swelling like a full term pregnancy. She had endured the discomfort of this condition for 5 years as there was no local medical help. Cause. The exact cause of leiomyomas is not known, but oestrogen is often implicated. Oestrogen as an ingredient in contraceptive pills. And pregnancy can increase their size and they usually shrink away with the menopause. When estrogen levels drop, they can similarly shrink after pregnancy. Symptoms. Although they originate from muscle fibroids and they don't function like muscles, but their presence can be a hindrance. When the uterine muscles contract or go into spasm during muscular cramps, for example, they can make the pain worse. They may cause the endometrium to bleed more during periods or between cycles, and they may make it more difficult for a fertilized egg to implant itself in the uterus. Larger growth can cause backache as they press on nerve, heaviness in the pelvic region, make intercourse painful, and cause urinary problems, constipation, and even prolapse. They can trigger a spontaneous abortion, leiomyomas. Leiomyomas can shrink, liquefy, and become cysts or harden and turn septic, or they may stop developing and become totally inert but not disappear. Rarely, in less than 0.5% of cases, they can become malignant. Kung malignant, ang tawag na sa kanya is leumyosarcomas. Treatments. There are various types of treatment available. First, the rate of growth should be established by 6 monthly ultrasound or manual examinations. If there are no symptoms and little visible swelling, then no intervention is necessary. A rapidly growing tumor should be kept under observation to prevent it leading to complications. Removal of small fibroids by keyhole surgery is helpful if it is suspected that they have been preventing conception. As a routine precautionary measure, the excised tissue will be examined in a laboratory to make sure there are no signs of malignancy. There are drugs that suppress or neutralize the stimulation of estrogen and progesterone by the ovaries. This treatment will cause the growth to shrink to about half their size, but there are side effects. Blocking the hormones in this way creates, in effect, an artificial and premature menopause. Periods will stop, and there may be hot flashes and other menopausal symptoms. If continued for over 6 months, there may be an increased risk of osteoporosis. Sometimes, if a hysterectomy is necessary, this form of chemical shrinkage beforehand may make it possible for the operation to be a vaginal hysterectomy rather than the more major abdominal operation. Embolization is a popular method of treatment. Embolization. Zation. Is a popular method of treatment. This involves chemically blocking the uterine artery, cutting off the blood supply to the growth. Without blood to nourish them, they shrink and degenerate. Other aids. I have come across women who have been successfully treated for fibroids by homeopathy. Although this seemed to present more a challenge to this approach than polyps and ovarian cysts, since even if surgery is required, it is unlikely to be treated as an urgent case. I would recommend trying homeopathy as soon as fibroids or myomas have been diagnosed. Most growths seem to thrive in background of stress, so managing your stress can also help limit their development. Give up coffee, alcohol, and other stimulants. Make any other changes to your diet that the lifestyle program suggests, and take up relaxation techniques. So we're done with the fibroids. God bless! Babalik ako, mag-ano ulit ako ng isang live para naman sa panibagong